Thank you. So, Michelle, I think you have just slightly less than a minute extra as a gift to Brian and Ron. But we look forward to your comments.
Thank you. Well, good afternoon. I see that the clock doesn't start until I'm up here, so. Thank you. It's my honor and privilege to be with you this afternoon and to present with my esteemed colleagues on the panel, and I appreciate the opportunity. So this afternoon, I'm going to be talking about training non-traditional students in public health through the Bloomberg American Health Initiative, and I'll talk just a little bit about what that is. So life expectancy, as most of you, or all of you are aware, started to decline about 3 years ago for the first time in a century. During that time, the Bloomberg American the School of Public Health at Johns Hopkins University was celebrating their centennial anniversary. And the Bloomberg Philanthropies wanted to give a gift in celebration of that centennial. There were several proposals that were submitted to the leadership of the Philanthropies, and none of those really captured what it was that the philanthropy was really interested in, which was how do we look at addressing this decline in health in the US. And so the leadership at the school thought about what is it that's impacting health. And so we recognized that it was addiction and overdose, environmental challenges, obesity in the food system, adolescent health, and violence. These things that are not necessarily in the wheelhouse of public health. And so this gift was given to us, and so we do this, and we really look at how do we impact health in these 5 areas through this lens of policy, equity, and evidence. So what are the policy levers that we have available to us? What are some of the policy barriers? What are some policy changes that perhaps needs to be made? What does the evidence suggest in terms of the data? Where are there opportunities for us to be more impactful? And certainly through the lens of equity. Equity in terms of social equity, in terms of health equity, in terms of economic equity. That's the frame with which we do this work, trying to address these 5 specific issues. So the gift from the Bloomberg Philanthropy was a gift of $300 million. It supports 25 endowed professorships. It also supports 50 full tuition scholarships for individuals who are interested in MPH degrees every year, as well as 10 DRPH degrees. Again, we award those every year. So a little bit about the fellowship program. And so we have these 3 areas of education, research, and policy, but I'll speak specifically to the education component. So to date, we have 37 fellows that have been through our program. They represent 15 states and DC, 1 territory, and we currently have 2 graduates. They are coming from a host of different organizations across the country, and I'll talk a little bit about who some of our fellows are. And I'm highlighting fellows that are in non-traditional public health spaces. We do have individuals, some of our fellows, about 40% of those are coming from local, state, and federal health agencies, but I want to talk about the ones who are not, the ones who are in those non-traditional spaces. So the fellowship program, we are focused on impact. We're trying to figure out who are you in non-traditional spaces that you may not necessarily know that you're impacting health, but you certainly are. We want to know who you are. We already know that there are individuals who know that they want a Master's of Public Health degree. They're very clear about the trajectory in which they're choosing to go. But then there are those who are in non-traditional spaces who may not even know that they're interested or that they're doing things that's impacting health. And those are the individuals that we're looking for. So Allison Miller, for example, and I only have a few of these. Allison works for the North Carolina Office of the Chief Medical Examiner. And Allison said, by the time the individuals get to me, it's way too late. They have gone through a life cycle, maybe super early on, unfortunately, and she was seeing that a lot of individuals who were who were brought into the Chief Medical Examiner's office were individuals who unfortunately had died from some type of overdose, unfortunately. And so she applied to the fellowship program with this understanding of what can she do along the trajectory, beyond doing data coding, beyond looking at who those individuals are. What is it that the Office of the Chief Medical Examiner in North Carolina can do to support individuals who are living in communities experiencing substance abuse use? Amanda Capitamino is in Alaska. She works for the Assistance Against Family Violence. It's a nonprofit organization that provides services to victims of domestic violence and sexual assault. And she wanted to know, I'm seeing these individuals in communities. I'm working with them in schools. What is it that we can do? What can I do to support my community in terms of what I'm seeing as it relates to violence? Jennifer Spiller, she's in Grand Rapids. She works for the Healthy Homes Coalition in West Michigan. She focuses on environmental challenges in the home. What is it that she's seeing individuals with high asthma triggers, with air quality issues? What are some of the things that she can be doing to support housing and health for individuals that she's working with? Ashley Hickson is in Houston, Texas, looking at obesity in the food system through the American Heart Association. What currently is available in communities in terms of food access that's causing obesity, that's then leading to heart disease that then impacts mortality. I'm doing great on time. Veronica Helm is with Adolescent Health. And so her focus area is adolescent health. And she's with the U.S. Department of Housing and Urban Development. She's with HUD. And one of the things that Veronica wanted to know is how does health and housing initiative intersect with adolescent health? And what are some of the things that are happening in housing buildings and assistance programs that could be done differently? What are some of the policies that are impacting health that at the federal level she can help to inform? And Haven Wheelock is in Portland, Oregon with a nonprofit organization, Inside Out. It's the first needle syringe exchange program in the country and the first publicly funded program. And really, Haven was one of those individuals that said, I would never get into Hopkins. This is the work that I do. This is the community that I love. She heard about the program. And we said, you are the kind of individual that we're looking for. I will tell you that each person that applies to the program must submit an application with their organization. So these wonderful fellows that we have, Outside In also had to submit an application. The U.S. Department of Housing and Urban Development also had to submit an application. And the reason for that is after these individuals are trained, they go back to that organization and they stay for at least 1 year. That is their commitment. Our thinking is that these individuals go back and inform their organizations about the importance of the tools of public health and how public health really does matter and what public health can bring to the way they do the work and the process in which they do the work. So to date, we have 62% of our fellows are in non-traditional organizations. 94% of them are on the East Coast. About 6% are on the West Coast. 0.2% are in other parts of the country and in one territory, as I mentioned. The program can be done part-time online or can be done full-time attending classes at the School of Public Health in Baltimore. The DRPH program is offered only as a full-time program. 96% of our fellows are women and 4% are men. This is just an image of our fellows that was taken at our annual summit that happened just last November. And so some of the courses that are designed, again, in partnership. We're hearing from organizations in terms of what they want, what they need, what would be helpful. So we're really clear at the School of Public Health what the academic trajectory is. We know what courses you should be taking. We know how to keep you on track. But we also wanted to hear from the organizations in terms of how we can be helpful. This is a partnership. So some of the courses that we heard from the organizations as well as our fellows is that it would be really helpful to understand critical issues in health disparities, understand suicide prevention from a public solving seminar, understand the opioid crisis also from a public problem-solving perspective. Some of the seminars that we offer are performance management and public health. These are the things that we've heard from our fellows from their organizations. Every other month, we have a call with them to say, hey, how are things going? Beyond your academics, beyond what's happening in your organizations, tell us what would be helpful. They said, we want leadership training. We want to understand advocacy. We're talking to individuals, but we don't have communications or media training. Or we get grants, but we don't necessarily know how to implement them. So it would be really helpful if you give us an opportunity to help us understand how to better do that. We give separate dollars to organizations from which our fellows currently work so that the organizations are able to see benefits immediately. So one of our fellows is with the Cherokee Nation, and they wanted to look at data assessments for the opioid use-related disorders, and we were able to provide funding specific to those organizations. Some of the organizational requests include research opportunities with our faculties, connecting with similar organizations across the country, and guidance as it relates to policy changes. Some of our incoming fellows for 2019 come from various organizations. We have Change Lab Solution in Oakland, the Indiana University, Child Justice. That's a lawyer. We have Fort Lauderdale Police Department, because we do believe these organizations are impacting health. These individuals are working in organizations, and it's our goal to be able to train leaders across the country. This is where we are. The blues represent our fellows. The orange represents research opportunities that we're doing. And our goal is really to fill this map. We think about how can we find public health advocates in non-traditional public health spaces. And our goal is just to have them all across the country. And I'm out of time. So I will just say, if you know a change agent in your community, send us an email so that we can be in contact with them. We want to be able to be resourceful and be helpful. And this is, again, a fully funded scholarship. And so I look forward to any questions that you may have. Thank you so much.